Diana Villanueva, Vice President of Housing First Programs for the San Diego Housing Commission, along with Fallon Lazinski, Special Programs Manager for the Homelessness Response Center, and Hanan Scrapper, Regional Director for People Assisting the Homeless, or PATH San Diego. We will provide the following during this presentation: an overview of the City of San Diego Homelessness Response Center, including background about its development, its two major functions, location and hours, services offered, and how to access those services. The Homelessness Response Center is an expansion of the Housing Navigation Team project established during Operation Shelter to Home. Operation Shelter to Home was a collaborative initiative to protect the health of San Diegans experiencing homelessness during the COVID-19 pandemic and help them obtain housing as quickly as possible. The City of San Diego, along with the San Diego Housing Commission, the Regional Task Force on Homelessness, County of San Diego, city shelter providers, and other collaborative agencies launched Operation Shelter to Home to mitigate the impact of COVID-19 on people experiencing homelessness in San Diego. It included a temporary emergency shelter at the San Diego Convention Center. A key goal of Operation Shelter to Home was to pilot new practices and design a more client-focused system consistent with the City of San Diego Community Action Plan on Homelessness. Operation Shelter to Home included the Housing Navigation Team, which focused specifically on working across all agencies and clients to help facilitate all steps involved in each person's pathway from homelessness to housing. Coordinated shelter entry, which streamlined and expedited the process of accessing shelter beds, and coordinated street outreach to cover more hotspot areas, enhance services offered, and coordinate with other services available in the community. With the processes piloted and lessons learned from Operation Shelter to Home, the Housing Commission designed and launched the Homelessness Response Center. The Homelessness Response Center expands the services offered through the Housing Navigation Team, centralizes core services in one location to encourage collaboration among agencies, and coordinates all of the activities to move someone from homelessness to housing. The Homelessness Response Center makes available a wide range of services to people experiencing homelessness. It is a gateway into the homelessness response system and serves as a hub for system navigation and supportive services. The Homelessness Response Center is a collaborative effort between the San Diego Housing Commission, PATH, the City of San Diego, and the Regional Task Force on Homelessness.
Hi, I'm Fallon Lazinski, Program Manager for the San Diego Housing Commission, overseeing direct operations of the Homelessness Response Center. All HRC programming is client-centered, is aligned with Housing First principles, and emphasizes collaboration among service providers to streamline the provision of services to people experiencing homelessness in our community, and connects people to housing options that best meets their needs. Collaborating service providers make up a broad spectrum of needed services to help connect people to the homelessness response system. These services include connection to outreach, shelter, and basic needs services. Supportive services like behavioral health and system navigation staff focus on navigating through all stages of the pathway from homelessness to housing. The Homelessness Response Center serves two major functions: system navigation services, where System Navigators will coordinate services for clients across community providers and focus on achieving the best housing outcome. Our System Navigators will collaborate with clients, homeless service provider agencies, permanent and longer-term housing resources, and community agencies like the Regional Task Force on Homelessness to facilitate all steps in connecting someone to a housing resource and subsequently to placement into permanent housing. Another function is the supportive services on site, where services are centralized at one site to provide enhanced access to a variety of service providers in our community.
The Homelessness Response Center is located at 1401 Imperial Avenue and is currently open Monday through Thursday from 8 to 4, Fridays from 8 to 2, and Saturdays from 9 to 3. The San Diego Housing Commission operates and administers the program on site in collaboration with key partners.
Hi, everyone. I'm Hanan Scrapper, Regional Director for PATH San Diego. Stands for People Assisting the Homeless. A key component of the Homelessness Response Center is providing system-level navigation services focused on helping someone experiencing homelessness complete all activities related to moving into housing. System Navigators work closely with clients and each client's primary case manager to provide support related to obtaining permanent housing. System Navigator services are intended to support existing resources and efforts, not duplicate the activities that are already taking place in our community, more so focusing around enhancing the existing services. The HRC uses a client-centered service approach delivery model that is collaborative with the client and service providers and addresses system-level barriers to support someone in ending their homelessness. Path, as the lead service provider for the system navigation services, has a team of 10 that are located on site daily. We have a program manager who oversees the day-to-day operation and supervises the team on site and lead case conferencing efforts across all entities. We have 2 intake coordinators who conduct the intake and assessment, determine the appropriate level of service needed for the client, and make that connection immediately. We also have 6 system navigators who provide system navigation services to clients who are connected to the Homelessness Response Center, and they help resolve any barriers client may experience related to obtaining a permanent or long-term home for them and their families. A clinical system navigator who is currently providing system level navigation. It's really focused around individuals who are high acuity and need a higher level of care and support to complete the activities related to moving into permanent housing. There are 3 system navigation service components that focus on providing support to clients and service providers in our community. The first is service coordination. The service coordination helps with people who are already referred and enrolled in a housing resource and have a case manager. This can include people who are referred and enrolled in a housing resource through the coordinated entry system, such as through the rapid rehousing programs or permanent supportive housing, or another permanent housing resource for people experiencing homelessness outside of the coordinated entry system, like diversion and shallow subsidy. The second component is case management. Case management helps people experiencing homelessness who access system navigation services through the HRC who may not currently be connected to a case manager who's working with them to obtain permanent housing. This can include working with people experiencing homelessness who are eligible for a housing resource and not connected to the coordinated entry system, or people who are referred and enrolled in a housing resource but do not have a case manager assigned to them. The third component is assessment and referral, which helps people who are not eligible for a housing resource through the coordinated entry system to identify community level resources like shelter, diversion, and rapid resolution. These are the activities that take place in each of the 3 system navigation components. System navigators are working across all entities to identify support needed to help clients move into housing as quickly as possible. System navigators facilitate case conferencing discussions. They are identifying all steps needed to help clients move into housing and all the various activities that are needed to accomplish that. And they follow up on pending tasks that provide support directly and indirectly to the client as needed. And then the case management activities include, once the intake coordinator has conducted an intake, assigns a system navigator, the system navigator follows up with that individual to begin working on connecting them to the appropriate housing resources and identify the level of need that they have for services. They also help facilitate regular case conferencing sessions with the client and their primary case manager. That could include helping to obtain required documentation, make referrals to community-based referrals, community-level resources as needed. Referrals to services may include behavioral health services, Veterans Affairs supportive housing, or supportive services for veteran families, transition age youth resources, and other potential resources the client may be eligible for. The system navigator also makes referrals and connection to housing search and placement services, such as the Housing Commission's Landlord Engagement and Assistance Program, also known as LEAP. The assessment and referral activities include intake and assessment, which our intake coordinators do a comprehensive intake and assessment focused on identifying the individual's service level needs. During the intake, the HRC intake coordinator helps explore diversion and rapid resolution conversations. If diversion is appropriate for the client, the intake coordinator will work with the individual to help connect them to diversion resources in our community. In this case, the intake coordinator will provide light touch case management services for up to 90 days with a focus on resolving their homelessness. The team also accesses the Family Reunification Program through Downtown San Diego Partnership and utilizes the Housing Commission's diversion and prevention services. If the individual isn't able to resolve their homelessness with light touch support after 90 days, they will assign them to a system navigator who will work with them in connecting them to other resources in the community.
So this slide shows some of the key organizations who are currently offering services on site at the HRC. We have the County of San Diego Health and Human Service Agency, who's doing enrollment in CalWorks, CalFresh, Medi-Cal, and other general relief programs, as well as local benefits and clothing and food resources. Uplift is on site providing DMV assistance, including preparation for paperwork and documentation and transportation to and from the DMV. Homestart has a youth system navigator on site who's providing services for prevention and diversion for our transitional age youth, ages 18 to 24, as well as other domestic violence support services. Legal Aid Society, though not on site, is providing legal screenings, guidance, and expungement, and other support services through referral. 211 San Diego is providing connection to a network of resources, including prevention and diversion services and other benefit programs. Downtown San Diego Partnership is currently on site providing family reunification services, as well as other street-based case management services. The VA is on site to provide connection to benefits, medical care, mental health care, and substance use disorder treatment through referral. VVSD is currently on site providing veteran support services to transitional housing. Able Disabled Advocacy is providing connections to training and job assistance. NAMI of San Diego is currently on site providing SSI and SSDI, as well as alcohol and drug treatment referrals. And Dreams for a Change is currently providing stimulus and tax refund assistance, as well as financial counseling and other employment programs.
A foundational component of this program is the inclusion of system advisory groups consistent with the Community Action Plan's recommendation and guiding principles to be accountable, value the voices of people with lived experiences, and communicate and collaborate more effectively. The advisory groups will include people with lived expertise, frontline homeless services staff, homeless service provider leadership. In addition, the Housing Commission will be implementing a client customer service survey available by kiosk on site, as well as on a web-based platform to collect feedback that can help inform service delivery and refine programs across the spectrum of services provided by the Housing Commission and organizations it contracts with. For more information about the HRC, please email hrcsd@sdhc.org or visit the San Diego Housing Commission's website at www.sdhc.org and select Homelessness Solutions from the main menu. Thank you for your interest in the City of San Diego Homelessness Response Center.